So you've got Hunner's lesions. What are the right treatments? Now I'm going to tell you in my office, one of the things that I find the most tragic are patients who have been in long-term chronic pain from their bladder, who have been diagnosed with Hunner's lesions that were never treated correctly, or they were never treated at all. And that absolutely breaks my heart, because what the research shows is that when lesions are treated correctly, the pain improves in the great majority of IC patients. So if you've been diagnosed with Hunner's lesions, it's very, very important that you ask, were they treated? Number two, how is the doctor going to treat them? So according to the AUA, Hunner's lesions can be treated in 4 ways. Number one, they can be cauterized. They're usually cauterized. They either call it a fulguration or laser therapy. And the theory behind the cauterization is that we're just kind of sealing shut this open wound that's so sensitive. The second thing they can do is a steroid injection, a triamcinolone injection right into the center of the lesion. The advantage of the steroid injection is it doesn't leave scar tissue. The cauterization will leave scar tissue that could impede your bladder's ability to expand and contract. So the steroid injection is more preferable than the laser therapy, but there are some doctors who do both, and actually it's the doctor's decision based upon what they see in your bladder, right? I mean, ultimately, in the end, they have to make that spot decision when they're looking at the lesions. The third thing that has been shown to be effective for Hunner's lesions is actually hyperbaric oxygen therapy. Now, you may know of this because this is a treatment that's given to scuba divers who get the bends. So if you were a scuba diver and you surfaced too rapidly, what they would do is they would put you in an oxygen chamber that would just flush your body with oxygen to reverse that. Well, it turns out hyperbaric oxygen therapy is actually really good for a number of health conditions, including burns, that when you flood the body with oxygen, it really helps tissue heal. And it turns out that hyperbaric oxygen therapy has been found to be helpful for patients with Hunner's lesions. So that's something you could consider. And kind of the worst case scenario, if you have lesions that are just not responding to treatment, they can do a surgical resection of that lesion and just remove that lesion from the bladder wall entirely. But that's kind of a worst case scenario. So anyway, we have got 4 viable treatments, but just know we have a lot of research coming down the pipeline now. We have some research from Europe that's been confirmed here in the United States that some Hunner's lesions are the result of a viral infection, and specifically the polyoma virus or the Epstein-Barr virus. So in the summer of 2023, we have a new study from Europe which not only identified the Epstein-Barr virus, but also used an antiviral medication to treat the lesions, and the results were promising. So I think we're going to see a lot more research on viral infections and lesions and the use of antivirals. And then we also had a fascinating case study that was published 2 years ago of a woman with severe Hunner's lesions who also had a severe prolapse. And when they went in to repair the prolapse, they made a remarkable discovery that her uterus was facing backwards. So the front of her uterus was facing backwards and the back of her uterus was facing frontwards. Why? Because one of the ligaments that normally holds the uterus in place had broken, so her uterus was free swinging around a ligament. Well, and that helps us kind of support the theory that some other lesions could be the result of neuroinflammation, a nerve that is very compromised. So if you have a uterus that's free swinging, we have a lot of twisting going on, which is potentially irritating nerves. So something remarkable happened when they restored the position of her uterus. Her Hunner's lesions healed completely. She's considered a complete and total cure. So the name of this condition is called Posterior Fornix Syndrome. That's F-O-R-N-I-X, Posterior Fornix Syndrome. And so that's something that you can ask your gynecologist to check you for. It's a very simple exam. Use a little wooden speculum by the cervix and try to lift up where the ligaments are. And if they lift up and symptoms get better, then that tells us that you might have a broken ligament or a tilted uterus or something like that. So just know we've got some really good, promising research happening right now with Hunner's lesions. So carry hope in your heart, my friends. And remember too, with Hunner's lesions, you're going to be very, very diet sensitive. So you got to protect those lesions. You've got open wounds in your bladder. So let's make sure you're not doing the coffee and the soda. All right?